write your name and your student ID in the chat box right now, and then we will start the session during next 3 minutes. Could you please ask your colleagues to join us? So did you get my message, colleagues? Write your name and your student ID in the chat box, please. Thank you, Mortaza. Thank you, Yasser. I do appreciate all of you. Good. Bismillah ar-Rahman ar-Rahim. Hello, everybody. Let me to share my screen. Please let me know if you can see my screen. If you have any question from the previous session, please raise your hand and unmute yourself. So, can you see my screen right now?
Yes, doctor.
Thank you. During this session, I would like to make a review from all of the topics that we covered during the previous session. Let me to start by the reference book. As you know, your course name is Principles of Epidemiology. This is Karami, Professor of Epidemiology at Shaipesh University of Medical Sciences. During this course, I ask all of you about, these two main textbooks, the main textbooks, and first one is the Gordis Epidemiology. The Gordis Epidemiology is the source of the majority of PowerPoint presentations. So a majority of the topics that we covered during this semester will be based on the Gordis Epidemiology. And we will use the chapter 8 of the Clinical Epidemiology reference book. And as you know, I have sent all of this material along with PowerPoint presentation slide with the representative of the class. We introduced epidemiology and categorized epidemiology in descriptive epidemiology and analytical epidemiology. In descriptive epidemiology, the aim is to identify and address the distribution of diseases, okay? So in descriptive epidemiology, we are going to know the extent of disease. We are going to know number of cases of a disease. For example, for instance, if you like to know the epidemiology of diabetes in your country, Iraq, if you are going to describe the epidemiology and distribution of diabetes in your country, you should adopt this descriptive epidemiology. By descriptive epidemiology, it is possible to know the distribution of epidemiology, the distribution of disease and cases, like number of cases, number of deaths by person, by place, by time. When we say distribution of cases by person, we mean frequency of case of disease among population, incidence, prevalence, mortality rate, DALI, and so on. It is possible to describe the number of cases by gender and sex distribution, by age distribution, by educational status, by job or occupation, by race, by different levels of socioeconomic status, by underlying disease, by anything, okay, by history of immunization. So it is possible to know that diabetes is a prevalent disease among both sexes, but the majority of the diabetes cases are prevalent among women, for example. This disease is prevalent among those who have more than 30 years old, okay? And you should say that a family history of diabetes or, genetic susceptibility plays a major role in getting diabetes throughout the life of people in Iraq, for example, okay? And you should say that those who are obese with a higher value of BMI, have a higher rate of diabetes and diabetes complications. So this is distribution of diabetes in your country by person. You can say that, for example, we have a higher prevalence or higher rate or number of cases of diabetes. And for example, it is just an example, suppose that it's hypothetical distribution. In north of Iraq in comparison to south of Iraq, okay? And you can say that by time, for example, a time about diabetes is not, doing well, is not, true. But about infectious disease, for example, we have higher rate and higher incidence of influenza, of measles, of brucellosis, even tuberculosis in the winter and spring during the year. So we have, for example, higher rate of accident crash throughout the night and early morning in comparison to other, times throughout the life. Again, in the case of place, it is possible to say that, north, east, west, south. You can say that, for example, some ward. For example, you have higher rate of nosocomial infections, hospital-acquired infection, and ICU ward in comparison to, for example, surgery ward, okay? So this is descriptive epidemiology. In analytical epidemiology, our approach is to determine the cause of disease, the association between risk factor or etiology of disease. As you know, in the case of non-communicable disease versus in comparison to communicable disease, we have risk factors, not a specific etiology. For instance, if anybody asks you about the etiology or cause of the COVID-19 coronavirus, so clearly you state that the etiology or the cause or the determinant of the COVID-19 as having exposure with SARS-CoV-2 as a virus. So this is etiology or cause. But in the case of non-communicable disease, suppose that cardiovascular disease, it is not possible to explain just one cause. You should say that we have majority or a variety of risk factors. Again, examples will be unhealthy diet, will be lack of physical activity, will be, obesity, will be diabetes, will be blood pressure for a stroke, for example. So this is important that in the case of non-communicable disease, the etiology or determinant usually will be risk factor of the disease. But in the case of communicable disease, usually, and the main role will be about, a biological agents like virus, bacteria, or so on. There is a fact in epidemiology that, the disease are not randomly, and the cases of disease are not randomly distributed in human population. As in the case of something and some determinants. I ask you, all of you, to memorize and recite this definition of epidemiology based on the Michael Porter dictionary. Do you follow me, colleagues? Everything is okay?
Yes, doctor.
So, I ask all of you to recite this definition of epidemiology. The study of the distribution and determinants of health-related states or events in specified populations, and the application of this study to control of health problems. The study of distribution. So this item covers descriptive epidemiology. And determinants. This item covers analytical epidemiology. Here we are going to know extent of cases of disease in the population. Here we are going to know the determinant, the etiology, the cause, and the known risk factors of disease. And as you know, in epidemiology, we are not limited to just diseases like tuberculosis, like malaria, like stroke. We also cover all of the health condition, all of the health events, all of the events, even social events that affect the human body health, the health of human being. So some social, items like divorce, like air pollution, that affect the health of population will be covered and considered by epidemiology. And the second part of this definition, including the application of this study to control of health problems. So, after studying the distribution and determinant of disease and realizing that there are some risk factors like physical inactivity, like unhealthy diet, like hypertension, that lead to and are the main causes of the stroke and cardiovascular diseases. So you should make some intervention. You should apply some change on these items. So this is the role of epidemiology. Any question, colleagues? So shall I continue, colleague? Do you follow me?
Yes, doctor. Thank you.
So after the definition of epidemiology, we introduced the 5 objectives of epidemiology. The first one is to identify the etiology or cause of a disease and relevant risk factors. As you know, and familiar with risk factor means factors that increases the risk of developing disease, the risk of initiating the disease or developing disease among people. So you should consider this, that identify the etiology or cause of a disease and relevant risk factors. The second one is extent of disease, to determine the extent of disease. By knowing the distribution of epidemiology, it is possible to know the extent of disease. The third one is to study the natural history and prognosis of disease. The natural history or natural course of disease, colleagues, means, suppose that you have a patient or some case series of patient, not just one cases, and getting some disease. If you don't make and apply any intervention, prescribing nothing, doing nothing, and just follow this patient to study the natural course and progress of these diseases. So this is the natural history. And by epidemiology, it is possible to follow the natural history and prognosis of a disease. The fourth one is about, evaluation of preventive and therapeutic measures. For example, by epidemiological approach, by conducting epidemiological studies and research in the field, it is possible to evaluate some, therapeutic and preventive measures. Let me make an example. Right now, in the case of lung cancer, nobody recommend people to screen yourself in the case of lung cancer. Why? The situation is not true in the case of breast cancer, in the case of cervical cancer, in the case of colon cancer. In the case of colon cancer, everybody, especially those who are a family history of colon cancer, recommended to do screening. At this recommendation by physician, by all of you after graduation, by you as a medical doctor, is based on epidemiological study and epidemiological evaluation of the recent, updated evidences. The final objective of epidemiology is, providing some recommendations, some general advice to adopting and comparing items. For example, all of us use, the mobile phone, okay? All of us use the mobile phone. Colleagues, do you have my screen right now? Everything is okay?
Yes, doctor. But don't share with us, doctor. Presentation with us.
Okay, yeah. I cannot hear you, but that's okay. Could Could you please type in chat box or just simply react to my questions? That's okay. Do you follow me right now? Do you have my screen?
Doctor, we don't see the share with us presentation. We don't see it.
Okay, colleagues. So,
excuse me, doctor, the slide is, we can't see the slide and your voice is so far.
unfortunately, I cannot hear you, Mustafa Hadi. So could you please write in the chat box if you have any question? Okay, colleagues. So suppose that all of us use, the mobile phone. So do you think this using the mobile phone more than 10 hours during every, day causes or lead to or increase the risk of developing brain tumor or not? So this is, answer of epidemiology to such question that it is possible to, based on the research, we can answer to these items. And as you know, epidemiology, has the vital role in the case of conducting of research and in clinical epidemiology. And so we will, explain that more in detail. So during the previous session, I introduced health transition and stated that health transition includes epidemiological transition, demographic transition, and nutritional transition. And we ask all of you to have a look throughout this website, I mean the healthdata.org from GBD. And I shared you this website. And as you can see here, you can see the main and top 10 causes of diseases, okay? As you can see in this slide, we have top 10 causes in 19th century and 2014. And as you can see that in 19th century, pneumonia, influenza, tuberculosis, and generally communicable disease was, were the first top 3 causes of death in the USA. But after, more than 100 years later, you can see that non-communicable disease stand on the first causes of disease. By searching in this website, I mean GBD Compare, it is possible to check not only the status of a number of deaths, number of top 10 cause of deaths, top 3 cause of deaths in 1990 and in 2019, it is possible to check for YLD and DALIs, okay? So as I ask you, it is possible to, replace the global by your country and your interest and continent. So if you replaced global by Iraq, you can see the top 10 cause of disease in Iraq. And as you can see, non-communicable disease in Iraq right now are the top 3 causes of death in Iraq. If you change these to YLD, I mean years lived with disability, the situation is different, because in years lived with disability, we considered not only death from disease, but also disability following disease. For example, in Iraq, mental disorders, musculoskeletal disorders are the top causes of death, causes of YLD. Why? Because we know that majority of mental disorders don't lead to death, and mental people and patients with a mental disorder are alive, but the problem is that they don't have a healthy life. They suffer from mental disorders like depression, like schizophrenia, and so on. Musculoskeletal disorder, majority of us, even myself, yourself, maybe because of low back pain, because of neck pain, and so on, have some disability, but we cannot measure this as a cause of death, but this is cause of disability. So you should consider this one. So another topics that we covered during the previous session was the types of prevention. Types of prevention has a major role in your work as a GP after your graduation. The first one is primary prevention. In primary prevention, we are going to reduce the incidence of disease. So when we are going to reduce the incidence of disease, this means that you should avoid the onset of disease. You should prevent the initial development of a disease. For instance, children got immunization. Why? We immunize all of the children against measles, against tetanus, against influenza. For what? For preventing the initial development of disease. So by drinking safe water, by eating healthy food, we can avoid the initial development of disease. So this is primary prevention. So the primary prevention lead to having less number of disability, less number of deaths, and so we have a healthy population if we adopt primary prevention. But in real practice, the situation is not true. And because of exposed to virus, exposed to bacteria, children get infections, children get accident, and so on. So the secondary prevention, the secondary type of prevention, if you adopt the secondary prevention, so it is possible to early detect, to early diagnosis of disease. If you early diagnose a disease, so though that patient has a good prognosis. And if you don't diagnose and detect a patient with a disease like, for example, cancers, so in the end stage of the cancer, those patients will visit you, will visit the health system. So what happened? You have a patient with the end stage and metastatic phase of the cancer. In this situation, it is not possible to save the life. And we have, high level of severity of disease. We have a complication of disease. So the secondary prevention is really useful for all of you. The tertiary prevention is focused on rehabilitation, like physiotherapy action and so on. And this phase, unfortunately, we didn't adopt not only primary prevention, but also the secondary prevention. So we have a patient with a stroke that's right now unable to eat, unable to walk. So what should we do? We should adopt the rehabilitation approach to reduce the impact of the disease. I asked two of the students to give us a brief presentation on primordial prevention and fourth level of prevention, as you may remember. So right now, we have a 5-minute break, and after that, I join the room to continue the topics, okay? We continue by clinical epidemiology topics, okay? So please join us again after 5 minutes. Thank you. Thank you, Yahya. Yeah. Hello again, colleagues. So right now, let me to resume the sessions. So as you can see in this slide, colleagues, epidemiology has a role not only in the field of clinical research, but also in the clinical practice. So as a physician, you need to know and follow, the application of epidemiology in clinical practice. Suppose that you are in a medical clinics and a mother with her child visit you. And the main complaint raised by the mother of these children and as pharyngitis. So you know that pharyngitis means inflammation of trus, okay, nasopharynx, trus. So pharyngitis. If you know the epidemiology of pharyngitis, as we ask you, if you search in Google, search in PubMed, search in any databases, any evidence-based medicine source, it is possible to find the epidemiology of the health condition and diseases. So if you search for epidemiology of pharyngitis, then you will realize that usually majority cause of the pharyngitis among children with less than 5 years old as virus. Okay, but majority of the cause of pharyngitis among children with less than 5 years, around 8 to 10 years old, as Streptococcus as a bacteria. And greater than this age, maybe Mycoplasma pneumonia. But the majority cause are group A Streptococcus. So let's be back to the example. You have visited a mother with her child that child has a 3 years old. So this patient with a 3 years old complained from pharyngitis. So according to the knowledge of the epidemiology of pharyngitis, based on your prior knowledge on epidemiology of pharyngitis, you realize that the cause of this pharyngitis may be viral. So if this pharyngitis is viral source, the virus is the cause of disease. So you don't need to prescribe any antibiotic. But in the second situation, if this mother visits you with her child and the child, has 8 years old, the situation is different, and immediately you should prescribe antibiotic and relevant medicine. Because if you don't prescribe antibiotic, this patient will experiencing a poor prognosis, a severe, cases, and later this may be the role of rheumatoid fever when they, get adults. Okay, so you should consider the knowledge of the epidemiology of disease in clinical practice, and during your all of your courses in internal medicine and surgery and infectious disease and gynecology, you have epidemiology of all of diseases that you should know. Okay, so epidemiology will help you in clinical practice. So after that, I gave some example like Edward Jenner example, and according to Edward Jenner observation, all of us know that Edward Jenner, based on observation in the field, realized that these young girls, this young maid that draw milk from the cows, getting a mild disease from cows. That name was cowpox. And Edward Jenner realized that why this young mate only getting a mild disease, but other people like children, like men's, experience a fatal and severe cases of smallpox. So they realized that maybe secretion from this lesion and wound on the hand of this young maid will be protective against smallpox. So as you can see in this painting, a dairy maid, Sarah Nelms, is bandaging her hand after just having had some cowpox material removed. The cowpox material is being administered by Jenner to an 8-year-old volunteer, James Phipps. So this is the first invention of vaccination. According to this, innovation, the vaccination is derived from the vaxa. Vaxa in Latin word means cows. So the vaccine has been obtained from the vaxa, means cows in the population. So any question, colleagues, before I start the second chapter? Okay, thank you. So right now I am going to start this topics, chapter 2, the dynamics of disease transmission. All of us know a fact that according to epidemiology topics, epidemiological concepts, diseases are not randomly distributed in the population. And human disease does not arise in a vacuum. Human disease arises and results from interaction of the host person, agent, and the environment. So we have this epidemiological triad of disease that explain the dynamic of disease transmission and why diseases happen. So what do we mean by host, and what are host characteristics? What are environment characteristics? What are agents? Host characteristics, including age, sex, race, religion, and so on. So all of these can has a role in developing disease. For example, family history of a disease, genetical profile of a family, so plays a role in developing disease. Race, religion. Some religion, maybe because of some healthy diet, won't experience some diseases. So the religion as a determinant on host characteristics. And even in the population, in the communities even if in the environment that we have some parasites, some viruses, some bacteria, because of some culture, some religion activities, maybe some people won't get the disease. Types of agents, an example of agents. Agents means maybe categorized in biological, chemical, physical, and nutritional. When we say biological agent of a disease, means bacteria, virus, fungi, and parasites. So in epidemiology and in your field, we have this. All of us know that we have bacteria for developing disease. We have virus, we have viral infection, we have infectious disease. You are familiar with this. And we have also some chemical agent. Chemical agent means alcohol, smoke, heavy metals, and so on, like lead. For example, lead lead to lead poisoning. High level of lead in, in occupational setting, after occupational exposure, maybe lead to lead poison, lead to lead poisoning. Physical means trauma. Physical means trauma, radiation, fire, and so on. Trauma is a physical agent. So when somebody experience a car accident, a collision, so this is a physical agent, not a biological one like SARS-CoV-2 for COVID-19. Environmental factors range from temperature, like heat stroke, like air pollution, noise, unsafe water, and so on. So all of these play a role in developing disease. In triad of epidemiology, these items, along with interact with each other and then lead to a disease. In the case of some disease, like malaria, like Marburg virus disease, like dengue fever, like yellow fever, and so on, we have, like CCHF, we have vector. So vector play a role. So let me tell you about mode of transmission of disease, how disease will be transmitted to other people. This is a clear picture of somebody while he is sneezing, he is coughing, he is maybe speaking loudly, okay, all of this, he is singing, okay. So as you can see, everybody, when speak, when cough, when sneeze, so exit droplets. What do we mean by droplet? Droplet means teeny material, tiny material, means small materials, small particles that include water and microbe and biological agent. This may be usually bacteria, maybe viruses. So majority of disease, including respiratory infection, infectious diseases like COVID-19, like measles, like tuberculosis, like influenza, like common cold, like meningitis, will be like poliomyelitis, will be transmitted by droplet, that we call these person-to-person transmission of disease. Because droplets are heavy and usually more than 5 micron, so after a while, droplet evaporates their water, and just we have droplet nuclei as a core of droplet, that this droplet nuclei as without water. So those are not heavy. Those are, lighter than droplet. So droplet as direct contact of transmission, direct method of transmission, direct mode of transmission of disease. But droplet nuclei will be transmitted by air. So we call this direct transmission. We call this airborne transmission. So we need ventilation in the room for avoiding droplet and droplet nuclei. During the COVID-19, all of people advised to wear mask. Why? Because wearing mask prevent transmission of droplet to each other. And we ask all of people to ventilate, to open the window, open the door. Why? Because ventilation lead to reduce the concentration of dose of droplet nuclei in an environment. So you have a safe environment and you have a low level of droplet nuclei, and the disease won't transmit to another person, okay? So the direct transmission and indirect transmission we have. Direct transmission includes droplets. Indirect transmission include airborne, vector-borne, and include common vehicle. For example, if you use a toothbrush of everybody, if you use a towel of everybody, if you use, other individual equipments and anything, so you may get the disease, because disease may be transmitted by vehicles. So vehicles include anything like food, like water, like your pencil, like your comb, like your towel, like your toothbrush, like your razor and Gillette, and so on. So a direct transmission means person-to-person contact and include direct contact and droplet. So let me give you some example according to the WHO website, okay? If you open up the WHO website and then follow the health topics of WHO website for every disease, that's not different. You can search for every disease. I mean, infectious disease, because in infectious disease we have mode of transmission, and in the case of non-communicable disease, the situation is different. So, if you open up the health topics of WHO colleagues, you can see some diseases like, for example, measles. You can open up the measles, meningitis. Could you please do the same, open up the WHO website? And after that, I will ask you for the mode of transmission of these diseases. Could you please search for all of these? And then I will ask all of you, okay? And another one is Marburg virus disease, for example. Could you please search for these diseases? Measles, meningitis, monkeypox, mpox, Marburg viral disease, and let me know and type in the chat box, please, or unmute yourself, and let me know what are the mode of transmission of these diseases, okay? Thank you. Okay, colleagues, please start. Please search. Even you can share your screen. If you would like, you can unmute yourself. You can raise your hand, and you can write in the chat box. You should check the, these topics And then let us know that how the disease is transmitted. For example, measles is a highly contagious viral disease. So we know that it is communicable disease, it is viral. And if you check the symptoms, you can see that this main sentence. If you check this main sentence, you'll find that measles is transmitted via droplets from the nose, mouth, or through of infected persons. So right now, you know that the measles will be transmitted by direct transmission, and the main mode of transmission is a droplet. So the question, Yasser, is that please search in this, as I shared you this URL from WHO Health Topics, okay? Or you can Google even, no problem. Search for this disease, measles, meningitis, mpox, and Marburg virus disease. Let me know that what are the mode of transmission of this self, and let me know, or you can, as I done, just type in the chat box and copy and paste in chat box the mode of transmission. Thank you. So right now you have 5 minutes to work on this. Please do, all of you, please do and share it with me. Thank you, Yasser, for sharing. Okay, so Yasser, do you think that you know, any insects or any vectors play a role in the transmission of Marburg viral disease? Let me to add another disease like CCHF or malaria. Malaria is a good example. So check that how malaria will be transmitted. Okay, Yasser. Thank you. So Yahya, yes, you're right. Thank you for your contribution. I do appreciate all of you. Please go on and practice these for your interested disease, mode of transmission of diseases. Okay, I'm waiting for your contribution. Okay, colleagues, I'm waiting. Good. Yes. Yes, we have sexually transmitted disease like HIV, animal or insect transmission, yes. Food or water transmission, healthcare transmission, you're right, yes. Good. So, for example, some diseases maybe have more than one way or one mode of transmission, like, for example, brucellosis, like HIV/AIDS, and so on. For example, brucellosis will be transmitted by, dairy product, infected contaminated dairy product, and also by, droplet nuclei. Okay. Yes, Sajjad. Malaria can be prevented by avoiding mosquito bite. Please, a good clue. Please keep in your mind that when you are going to study the mode of transmission, and after that you study the, how can prevent or prevention mode of a disease, how can prevent the disease. All of the prevention procedures, all of the prevention strategy is based on the mode of transmission. So as Sajjad right here, because we know that malaria will be transmitted by mosquito. So if you use, avoiding mosquito bites, so it is possible to prevent the malaria. Because you know that some disease will be transmitted by droplets. So if you wear mask and have a good ventilated environment and room, so it is possible to avoid the disease. How about meningitis, colleagues? Everybody that work on meningitis right now? Okay, thank you, Yasser, again. I would like to ask all of the colleagues, please make contribution. So, after Sajjad, Yasser again wrote that monkeypox disease can be transmitted through blood and blood fluid. It could be through respiratory tract infection, skin lesion, inhalation. Good example. So I'm waiting for meningitis and could you please search for brucellosis again? Let me. Can check for tuberculosis and so on. This is about Ebola virus disease. Please check Ebola virus disease. As you can see, Ebola virus disease is a severe and fatal illness affecting human and other primates. The virus is transmitted to people from wild animal, okay, such as fruit bats. And they spread in the human population through direct contact with the blood. So you should consider that droplet and direct contact droplet and direct contact are the direct mode of transmission of diseases, okay? So like tetanus, like any diseases that will be transmitted by direct contact of people, like handshading, okay? We can say that like droplet is a person-to-person and direct contact, okay? So the Marburg disease will be transmitted from wild animals or direct contact, okay? And meningitis, if you check meningitis, you know that meningitis is a vaccine preventable disease. So as you can see here, the bacteria that cause meningitis are transmitted from person to person through droplet of respiratory or through secretion from carriers. So you should consider this. So this is about meningitis. I would like to ask all of you to do this practice for all of the items, okay? This will help you to be, yes, this will help you to be updated about the mode of transmission of disease and be familiar with the epidemiology of diseases all of times. Thank you, Yahya, again. Sickle cell anemia. Yes, it's genetical, diseases. So we know that non-communicable disease approach is different. Majid, I didn't get Reza Majid, I didn't get your point. So again, I would like to inform you that for communicable diseases, we have biological agents like viruses or bacteria. And the mode of transmission could be categorized by direct contact, indirect contact. Direct contact including droplet or person-to-person and direct contact, okay? Like handshading, like kissing. But indirect mode of transmission or indirect transmission will be vehicle-borne, vector-borne, or airborne. For airborne, we have droplet nuclei, not droplet. Droplet, like meningitis, is about a direct mode of transmission, but droplet nuclei is different. So yes, this is the distribution of this Sajjad. If you read the epidemiology of any disease, you will find that okay, meningitis can affect people of any any age. This means that this disease is not a specific or limited to, for example, children or adolescents. This may be happen among elderly. This may be happen among young people. Okay. So meningitis is a contagious disease that the main cause of meningitis, including, as you can see here, Neisseria meningitis, Haemophilus influenza, like here, Streptococcus pneumonia, Haemophilus influenza, and Neisseria meningitis. As you know, Streptococcus pneumonia is bacteria. Haemophilus influenza, again, its name is bacteria as well. And Neisseria meningitis is bacteria again. Okay, so we have, these diseases, and right now we have vaccine against this, against meningitis. So, any point? Any question, colleagues? So before closing the room, you have time to ask me any question. Hope the next session will be, in person in the School of Medicine. Just for your information, during next session, I will start by slide number, I will continue by slide number 37 about the iceberg phenomenon and how we have a cell response, we have a host response after, exposure with biological agent, including bacteria, viruses, and so on. So that's all for today, colleagues. Have a next one, and see you next Tuesday. Happy Eid, and I wish you everything. I have sent you the PowerPoint, Yahya. I have sent the PDF version of the PowerPoint. So if I will, visit you and meet you in person, it is possible to deliver the PowerPoint, no problem. But the PowerPoint size of the, this file is very large, so it is better to give you in person. But right now you have. So if you write now, please write your email here. Please write email here, then I will send you the PDF version of PowerPoint slide presentation. No problem. But I am sure I have sent it. Okay, yes, sir. Just please, I would like to ask you that please send it for all of, share it for all of the colleagues and classmates, okay? Right now, I will try to send it for all of you, no problem. Any other question, please? Welcome, Sajjad and Yasser, other colleagues. Nice to be with you during this session. Have a good time.